Funding, the dream of self-supporting schools. In announcing the construction of the 3 initial industrial schools, Indian Commissioner Edgar Dewdney said that although the starting costs would be high, he could see no reason why the schools would not be largely self-supporting in a few years due to the skills in farming, raising stock, and trades that were being taught to the students. In supporting an Anglican proposal for 2 industrial schools in Manitoba, Indian Affairs Deputy Minister Lawrence Banconet wrote to Prime Minister MacDonald that it would be well to give a grant of money annually to each school established by any denomination for the industrial training of Indian children. He said the system worked well in Ontario and it cost the government less than the whole maintenance of the school would cost, and it enlists the sympathies and assistance of the religious denominations in the education and industrial training of the Indian children. The government believed that between the forced labor of students and the poorly paid labor of missionaries, it could operate a residential school system on a nearly cost-free basis. The missionaries and the students were indeed a source of cheap labor, but the government was never happy with the quality of the teaching, and no matter how hard students worked, their labor never made the schools self-supporting. Soon after the government established the industrial schools, it began to cut salaries. Initially, the federal government covered all the costs of operating the industrial schools. In 1891, this policy was abandoned in favor of one by which the schools received a fixed amount per student, referred to as a per capita grant. The system both intensified the level of competition among churches for students and encouraged principals to accept students who should have been barred from admission because they were too young or too sick. The government never adequately responded to the belated discovery that the type of residential school system that officials had envisioned would cost far more than politicians were prepared to fund. In the early 20th century, chronic underfunding led to a health crisis in the schools and a financial crisis for the missionary societies. Indian Affairs, with the support of leading figures in the Protestant churches, sought to dramatically reduce the number of residential schools, replacing them with day schools. The government abandoned the plan when it failed to receive the full support of all the churches involved in the operation of the schools. Instead, in 1911, the federal government finally implemented a significant increase to the per capita grant received by boarding schools and attempt to impose basic health standards for the schools. This resulted in a short-term improvement. However, inflation eroded the value of the grant increase, and the grant was actually reduced repeatedly during the Great Depression and the start of the Second World War. Funding for residential schools was always lower than funding for comparable institutions in Canada and the United States that served the general population. In 1937, Indian Affairs was paying on average $180 per student. This was less than a third of the per capita costs at the time for the Manitoba School for the Deaf, which was $642.40, and the Manitoba School for Boys, $550. In the United States, the annual per capita cost of the Chilocco Indian Residential School in Oklahoma in 1937 was $350. According to the American Child Welfare League, the per capita costs for well-run institutions in that country ranged between $313 and $541. It would not be until the 1950s that changes were made in the funding system in Canada that were intended to ensure that schools could recruit qualified teachers and improve the students' diets. Even these improvements did not end the inequity of residential school funding. In 1966, the residential schools in Saskatchewan were spending between $694 and $1,193 a year per student. Comparable child welfare institutions in Canada were spending between $3,300 and $9,855 a year. In the United States, the annual cost of residential care per child was between $4,500 and $14,059.